So, what are the most important causes or the common causes that can cause pain during cycles in young women?
The most common cause what we've seen is non-specific, what we call it as primary dysmenorrhea, where there's no reason. But when it is a progressive pain, that means every month the pain is increasing, every year you are seeing that pain is more and more related to few conditions. One, endometriosis. Second, could be starting of adenomyosis. Third, can also be related to fibroids. If the woman is not sexually active, very unlikely to be related with something called as pelvic infection.
So, what is endometriosis?
Endometriosis is a condition where the endometrial tissue which lines the uterus is implanted outside the uterus. That is into the pelvis, into the ovary, in and around the tubes. It can sometimes be even implanted in the liver, bowel, or even the lungs. So, when it implants outside the normal uterine cavity, it can bleed there and cause symptoms.
So, how common is endometriosis?
Nowadays, we are seeing it very common because we are able to diagnose this condition very early. I would say in a young adult or a young woman, it is as common as 2 to 3%, but in a reproductive age, we see it as common as 5 to 8%. But when we talk about fertility, when the patient is coming for a treatment for infertility, we have seen it as common as 15 to 18%.
So, can young girls also have endometriosis?
Yes, they can. We have seen patients as early as 15 to 16 years of age with endometriosis. If her menstrual period is very severe, it is progressive, that means every month we are seeing that there is an increased intensity and pain, and if the girl is not responding to simple analgesics, then it could be related to endometriosis. She is not faking. There can be something abnormal.
So, where does these endometriotic lesions usually appear or it can occur?
It can be inside the pelvis. Most commonly, it's in the pelvis. That means behind the uterus. That is the uterosacral ligaments, ovaries, or the pelvic peritoneum. Most often, we see this very, very small lesions in the immediately behind the uterus. That's why they have so much of pain in and around the periods, and sometimes even the difficulty to pass motion, pain during passing motion. So they generally start behind the uterus.
Does endometriosis go away on its own?
Endometriosis never goes away by its own. It is usually a progressive condition as long as the woman is having her period or menstruation. As long as estrogen and progesterone are active, it cannot go away.
So, you mean it's a lifelong condition, sir?
It is definitely a lifelong condition. I sometimes say that this condition, sorry to say, that woman has to deal with it lifelong. In the early phases of life, because of the pain, next, sometimes for the reproductive outcome, pregnancy, and throughout the life, they will have some kind of the other pain or symptoms associated with it. Yes, we do have a curative treatment, but then you have to deal with it lifelong.
Is endometriosis a cancer?
Yes, many patients have asked this question, is this cancer or can this turn cancerous? First thing is, it is not a cancer. Can it turn cancerous? Yes, but very rare. The chance of our incidence, what we've seen, the endometriosis turning into cancer is 0.5%, which is less than any other cancers also. But unfortunately, the treatment of this condition is more than that of what a cancer treatment is required. Cancer treatment is generally a short-lived treatment. We can completely cure it, and it is completely treatable, many of the cancerous conditions. But endometriosis, you have to deal with it lifelong.
So, sir, you also spoke about adenomyosis. So, what exactly is adenomyosis?
So, I said endometriosis is a condition where the endometrial tissue is present outside the uterus. Sometimes the same endometrial cells can get into the muscles of the uterus. When this endometrial tissue starts growing inside the muscle of the uterus, we call it as adenomyosis.
So, how common is adenomyosis?
Adenomyosis, of late we are seeing it very common. Previously, when I was doing my graduation, we used to say adenomyosis is the disease of 40s. That means after 1 or 2 pregnancies and deliveries, you used to get adenomyosis, and generally was diagnosed only after hysterectomy when we were sending it for histopathology. Now we are seeing this condition as early as age 20s, very commonly seen in the reproductive age. I would say if you talk about infertility and the incidence, we have seen it as common as almost 7 to 8%. But if you look at a reason for pain, when you are looking at pain, dysmenorrhea, we have seen it as common as 15 to 20%.
Is adenomyosis a cancer again?
No, adenomyosis is not a cancer, but again, it's a slow progressive condition. It, as this endometrium, which is deposited inside the muscle, will slowly grow, and as it's growing inside, it will cause lots of symptoms.
So, what are the symptoms of adenomyosis?
Adenomyosis, as I said, it's a progressive condition. In the initial stages, there are no symptoms. We do not see anything. Second is where they start getting dysmenorrhea. That means pain during period. Generally, the adenomyosis pain starts a few days before the period, then during period, and sometimes continues after period. This is called as triple dysmenorrhea. First, initially it starts during period, then the triple dysmenorrhea comes in, and many a times as it continues to progress, it will become so debilitating that patient is so much in pain that they want their uterus to be removed.
So, what are the other symptoms of adenomyosis?
As I said, the endometrial tissue starts growing inside the muscles of the uterus. So, the uterus size also will start growing. Generally, what we have seen is the uterus size becomes larger. There is heterogeneous myometrial echoes. So, as the uterus size has become larger, they tend to have more bleeding. So, they will have menorrhagia, bleeding with clot. As the uterus is larger, it is not able to control the bleeding more, so they tend to bleed more. So the number of days of bleeding is also more. Another very significant symptom of adenomyosis is that they have severe menorrhagia. Next is, yes, we have also seen it to be associated with infertility. Because the uterus is larger and there is so much of inflammation inside the uterine muscle, the implantation, that is the embryo, does not get stuck into the uterus. So the implantation rates are low, and the pregnancy, carrying the pregnancy also becomes a challenge in this kind of.
How do we diagnose adenomyosis?
Adenomyosis, as I said, symptoms. If you know these symptoms, then yes, more likely we can tell, okay, what is it. But when you come to the other imaging modalities, in the initial phases, many patients will not have the symptoms, but can be picked up in a transvaginal ultrasound. In transvaginal ultrasound, few things which indicate towards adenomyosis is: one is the enlarged uterus, increased vascularity, heterogeneous myometrial echoes, and disproportionate myometrial thickness. Sometimes we see that the myometrium, that is the uterine wall, is more thickened on the one area than the other. Most of the time it is the posterior wall of the uterus which is thickened. So these are certain indicators for adenomyosis. Now when we come with the symptomatic patients, we can very easily make out with an ultrasound. I would say in our hands, I would say almost 99% of time we will be able to pick up an adenomyosis uterus or adenomyoma also, because adenomyoma is a focal growth of adenomyosis inside the uterus. So I would say in our hands, ultrasound, more so the transvaginal ultrasound, we will be 100% able to diagnose a adenomyosis condition. Well, next modality is MRI. MRI is as good as 90-95% sensitive in picking up. But then, as I said, it is an expertise of the doctor who is doing the scan. With a transvaginal ultrasound, I can bet you we almost 100% we can pick up an adenoma.